This following presentation will be on depression, and specifically the ties between depression and suicide and self-harm behaviors. Included in this presentation will be various intervention strategies that can be utilized to battle these symptoms. Depressive disorders are one of the most common mental health diagnoses in the world. Specifically, the DSM-5 mental health diagnosis of major depressive disorder is one of the most common diagnoses in the United States and across the world. Around 7.1% of U.S. adults report experiencing at least one major depressive disorder in their lifetime. Given statistics of U.S. adults, this translates to roughly 17 million people across the world. In prevalence rates, it's found to be more likely in females, individuals who are 18 to 25 years old, and individuals of 2 or more ethnicities. The Diagnostic and Statistic Manual of Mental Disorders, 5th edition, or the DSM-5, lists specific criteria for major depressive disorder. This criteria includes at least 5 of the following symptoms to be experienced for at least 2 weeks. These include a depressed mood most of the day, loss of pleasure or interest in activities, significant weight loss or appetite change, sleep disturbance such as insomnia or not enough sleep, hypersomnia or too much sleep, or various sleep disturbances such as waking up in the middle of the night and not being able to go back to sleep. It also includes psychomotor changes such as agitation or retardation, fatigue or loss of energy, feelings of guilt or worthlessness, cognitive difficulties such as attention problems or inability to focus for a sustained period of time, and finally thoughts of death or self-harm. Like many other DSM-5 diagnoses, it's required that these symptoms cause clinical distress and cause significant functional impairment across multiple areas, including academic functioning, work functioning, and interpersonal functioning. As well, the symptoms should not be better explained by another mental health disorder or another physical health symptom. It's also important to make sure that there is not a comorbid diagnosis that better explains the symptoms, including a neurodevelopmental disorder, such as ADHD, a neurocognitive disorder, such as Alzheimer's or Lewy body dementia, or substance use, such as use of alcohol, marijuana, or stimulant. One of the biggest risk factors when reviewing symptoms of major depressive disorder is obviously suicide and self-harm. Major depressive disorder is the diagnosis most closely associated with suicide and self-harm behaviors. Almost 1 million people die each year by suicide. Specifically in the United States, suicide is the 10th leading cause of death. In the United States, the most frequent subgroups of individuals at risk for suicide are white individuals, middle-aged individuals, and males. As far as access to suicide and methods of suicide, firearms account for the highest percentage, as well as hanging and pill overdose. It is also reported that non-suicide behaviors, such as non-completed suicide attempts and self-harm behaviors, are estimated to occur around 10 to 20 times more frequently than actual suicide attempts that are completed. While major depressive disorder and suicide are well linked, the etiology of how suicidal ideation comes about can vary depending on the research you read or the theorist that has put forth the theory. First, there is the consideration of genetic factors. There have been several studies that have shown the genetic link between families with depression and future family members gaining depression symptoms later on in life. More specifically, there have been studies that have shown that a family history of major depressive disorder has significant ties to higher risk factors for future family members to have suicidal ideation, suicidal attempts, and self-harm behaviors. There is also the consider of environmental factors in suicide risk. There has been research that has shown that psychosocial stressors play a huge part in development of suicidal behaviors or self-harm behaviors. Specifically, there has been research that has shown that reporting of clinical depressive symptoms is not as big of an indicator of suicide risk as previously thought. Rather, the presence of various psychosocial stressors, such as lack of a support system, interpersonal factors like relationship problems, socioeconomic instability, and various physical health factors play a huge role in the indication of suicide and self-harm behaviors. One of the more common theories of suicide risk is the Joyner model of suicide risk. This theory states that individuals who experience perceived burdensomeness or the feeling that people would be better off without them or that they're causing people problems, coupled with feelings of thwarted belongingness, such as feelings of isolation and alienation or lack of a support system, coupled with an increased capacity for suicide. This increased capacity includes self-harm behaviors, which garner a pain tolerance, and also stimulus exposure to suicide-related stimulus. These factors are thought to couple together to drastically increase one's risk for suicide. There are also several other risk factors for suicidal behaviors and self-harm behaviors. These can include history of suicide attempts, a history of substance use or substance use withdrawal, presence of a physical illness or disability which harms the quality of life and increases psychosocial stressors, the loss of a family member or friend to suicide or self-harm behaviors, exposure to bullying and threatening behaviors from others, undiagnosed or untreated mental health conditions, especially conditions such as depression, anxiety, bipolar disorder, and other various mood disorders or personality disorders that involve impulsivity. It also includes a recent death of a family member or close friend and the involvement of loss and grief and depression symptoms that follow. It includes access to means for suicide, such as firearms or lethal medications, and can also include relationship difficulties, as we previously touched on with psychosocial stressors. Stressors and risk factors can also include impulsivity and poor judgment, difficulties in academic or work settings that provide additional pressure and psychosocial stressors, or the history or presence of physical, sexual, or emotional abuse. While depression is seen to be one of the more common mental health diagnoses, it is also shown to be a chronic disease that is often resistant to several treatment strategies. Fortunately,